Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today, we have a very special guest with us. We have with us Dr. Faiz Anwer, who is a hematologist and oncologist at the Cleveland Clinic in Ohio, who has been mentoring so many medical students from Pakistan and all over the world to achieve their goals and guiding them through the entire process of medical school. Dr. Anwer is an amazing teacher, an amazing doctor, and thank you so much for coming here on the podcast, Dr. Anwer. We're really excited to talk to you.
Assalamu alaikum. Thank you so much for the kind words and the introduction. It is true that mentoring is a passion, but it's also true that a lot of these students, it is their hard work, it's their ambition, it's their talent that they are doing wonderful work. And I'm looking forward to this session because through this video, I will be able to connect and reach to additional people who can benefit from this session. And my focus will be mentoring through this session.
Yeah. That's great. And I personally look at all of the posts that you share and all of the motivational quotes that you share. They're very inspiring. I'm really glad that we could arrange this today. So usually we start off with what your early life was like. How did you end up doing medicine and your journey to the US, and just a little bit about yourself?
Sure. So I initially grew up in Gujranwala, and that's where I did my schooling and my FSC. And after that, I went to Rawalpindi Medical College.
Yeah.
And during the Rawalpindi Medical College, I was living in a hostel, and one of our warden, who was a pediatrician, who became a mentor. Not only for me, we are a group of 5 or 6 friends, and we were living in the same corridor, and he studied and he inspired us to study hard. And that's where we started studying for USMLE. So within that group, some of the colleagues came to United States, and other colleagues went to UK, and other colleagues who are back home, they're also very successful. So I think early on, I gave a lot of credit to that one individual, Dr. Irfan, who is now a pediatrician in Alabama, who actually triggered a lot of ambition and guided us through the journey. So I think it's very important to seek out, to find those mentors. And very commonly, and I did that mistake too, very commonly we see that we seek out to somebody who is 1 year senior or who is 2 years senior. That may have a value for day-to-day workaround, but I think you really need to seek out a mentor who is probably 10 years mature than you are. And it has to be somebody with real passion, with real integrity. So from that, from a medical school, after that, I did my house job, 6 months in general surgery in Rawalpindi General Hospital and 6 months in internal medicine at Allama Iqbal Medical College. I did an additional 3 months internship in pathology. And this was a time I was studying for different exams and did my FCPS Part 1 as well. And I actually ended up staying back home and doing my internal medicine residency. So I actually did my internal medicine FCPS in medicine under the guidance of very fantastic faculty members here at the Holy Family Hospital. And after that, I moved to United States and did my residency again at University of Pittsburgh Medical Center. And my HEMONC fellowship was at University of Arizona. And during that time, I made up my mind to do bone marrow transplant fellowship. And I went to Fred Hutchinson Cancer Research Center, University of Washington in Seattle. And that's where I did my training. So it was a long journey. And I think what I want you guys to do is plan for a long journey. There is no shortcut in life. There is no shortcut in success. As success is the definition of success keep on changing, but success requires planning, guidance, mentoring, hard work, a lot of support from people around you.
Yeah. That's a very inspiring journey because I think that once you start off, there's a lot of hard work, especially in medicine, in any field of life, but especially in medicine because we have to study a lot and dedicate a lot of our time. But that's amazing.
Yeah, I want to share the personal motivation. My mother died of acute lymphoblastic leukemia, and this is my way of paying back, helping other students, though my personal focus is people who really are passionate about going into oncology to help them. But of course, we do not distinguish between people who want to become cardiologist or nephrologist or gastroenterologist. So I jokingly say if they become successful cardiologists that I failed, but I will take such failures on a daily basis. Uh,
Yeah. Definitely. I think oncology is generally very interesting as well because it's a very advancing field. There's new things coming out every day. I don't think that we still understand everything about the different cancers. It's becoming so common now, especially around us in our setup in Pakistan.
Few words about oncology. When I started pursuing oncology, I was not aware of all this, but oncology is generally divided into four different fields. It is benign hematology, it is malignant hematology, is it malignant oncology, and it is bone marrow transplant. And many colleagues may have an overlapping interest in, especially if you are in academic, that you may pick and choose one specialty and then divide your time, maybe adding another sub branch. So some people may combine benign hematology with malignant hematology. I know people who do breast cancer, but they also do some thrombosis and DVT work as well. So it is unique in a sense that each organ system is a field in itself.
Yeah.
Just within the hematology space, I only practice at plasma cell disorders, which is predominantly multiple myeloma, amyloidosis, and some other rare flavors of plasma cell disorders. There are colleagues who purely practice for myelodysplastic syndrome or myeloproliferatic syndrome. Some colleagues purely practice and focuses on acute myeloid leukemia or acute lymphoid leukemia. Other colleagues may focus on chronic leukemias. We have colleagues here who just focus on chronic lymphocytic leukemia. We have colleagues here who purely focus on amyloidosis space. So within the specialty, people can also focus. Now, if in a general practice, you have the player to practice everything. And I must say that 90% of the care which is being delivered in the USA is provided by the general oncologist, and they're doing a fantastic job. Though their job is getting difficult every day because of advancement, new therapeutics, new drugs, and complexities while you are managing these patients on an individual basis.
Yeah, definitely. It's such a vast field, but it's very interesting. I find oncology very interesting. It's something that really is so vast and there's so many aspects to it that it's very interesting. If we talk about other fields in general, there are a lot of IMGs from Pakistan who want to match in the US in their field of interest and who want to come to the US. You help a lot of people with this. And when we talked about this earlier as well, you said that there are certain aspects that you focus on when mentoring students and telling them about how to approach their application. What is the number one thing on the application that you look at and the program directors look at? And then what are the other aspects of the application that are important when applying?
So I think we need to be clear that there is no one thing that which we look at. We look at the individual, we look at their a balanced portfolio, we look at their journey. There are some individuals who really go through a lot of hardships and then achieve wonderful things, and they are rewarded for their distance travel, for their hard work. So we actually look at, I recently interviewed multiple candidates for a fellowship. And in general, any fellowship, and particularly here at the Cleveland Clinic, are the number of people we accept and the number of people who apply. We accept somewhere between 1% to 2% of the candidate for the fellowship. So you can imagine that the selection criteria is really high. So what we look at, we not only look at where they graduate from, and if they graduated from a medical school, were there in the top 10% of the class or the bottom 10% of the class, so that matters too. In addition to that, we also look at how they communicate. What are their hobbies? What are the pastime? What are the volunteer work they have done? their teaching potential, their academic potential, research and innovation interest. So there are multiple things which we look at. Scoring system we use actually counts the individual points for all activities. So if someone think that I got XYZ score to 50 or to 60 or to 70 and I'm successful, not true, because he has to be a balanced individual. And the best criteria, what is the best candidate? I heard from a colleague, we interviewed 6 people. At the end of the day, we met and we said this one candidate is the best candidate. And what was the criteria of the best candidate? A colleague said that if I personally have cancer, I want this individual to be my cancer doctor. So you want to be that physician. If you want to become a cardiologist, you want people to say that, I want to be healthy, but if God forbid, and I'm sick because of XYZ, I want this individual to be physician for myself or for my family. So this is the best criteria of the best doctor. So now you be the judge. It's not the score. It's not how good you teach. It's not how good you are in your social interactions. It's actually a combination of all these things. We want a physician who is good in academics. We want a physician who can smile, talk, and connect. We want a physician who's a good teacher and explain complex disease mechanism, therapeutics, side effects in a friendly way, in a commonly understandable way to somebody who has no medical background or a limited medical background. So that's the goal for you guys to be. And so that the medical student who's out there just entering the first year and second year, yes, it's important to focus on your academics. So be the best, deliver your best. Not for the scores. If you're putting your best effort, your scores will be best. There's no doubt. We in Pakistan, we take best of the best for the medical school. And so if you are the best of the best and put your best effort, your scores will be the best. So do not focus on the score. Go beyond that. Go for the knowledge. Go for the service. Go for the service with excellence.
Such great advice, I believe, because it's very important to remember that at the end of the day, we're treating humans, and it's the human aspect that is extremely important, because would you want that person to treat your loved one or yourself?
Junior medical student, please pay attention, develop some basic skills, learn typing, learn about the use of Microsoft Word, Excel, know how to make tables, know how to make figures, use of the PowerPoint, know how to go on the website and do some good quality library search for different resources, learn how to use citation software. And when I was in the medical school, internet access was a hardship. Now everyone has access to a YouTube video which can teach you all these things. All you have to do is be very selective with your time. Do not waste your time on the social media. Do not waste your time with the bad company. Be very selective in identifying who are your friends. Make small groups and clubs. And it could be anything. It could be a cardiology club. It could be an atrial fibrillation club. Invite mentors, invite speakers. And you don't need to be professor to start teaching. All you need to be wherever you are and start teaching yourself, teaching your small group of friends, teaching your younger siblings, teaching your whoever you can teach to patients, their families, because that's how you will become a better teacher. You learn how to bike. You don't become a pro biker and then start riding. You have to ride, you have to fall, you have to improve, and you have to build your stamina. That's how you become a pro rider. So that's how teaching goes.
Yeah, definitely. I think teaching is such a beautiful thing, because I think teaching is involved everywhere on a day-to-day basis, disease to the patient, talking to the patient, and interacting with the patient. It's all teaching in a different way.
Yeah, so I just want to talk about one thing which will guarantee you will fail. Do you know that? What is that? Lack of integrity.
Yeah.
If you cheat as a physician, as a medical student, as a student, I will guarantee you will fail, you will not succeed. So we see people who try to beef up their CV or try to beef up their profile by adding stuff which does not belong there. So please do not do that. Go for high moral character and always maintain your integrity, even if that means you're going to fail that week or that month or that year. It is okay to accept that defeat because you need to improve. So lack of integrity will make sure that you fail. And I will tell you what will make sure that you become successful. Do you know that?
Being honest and truthful.
Yeah, be honest, but then be a leader, be a proactive leader. When I say leader, I mean that you are your own CEO of your own success. Imagine you are an entity, you are a physician, you have a great potential, but then you need planning. You need a CEO to run all that ship of success, right? You have to take your own ownership. Once you do that, the people around you should benefit, grow together. So be kind, contribute to the growth of your colleagues and friends and people around you. That will make sure that you will succeed. I guarantee every individual who is a medical student and is there on merit, they will be successful. They will be highly successful. When I was going through my medical school, I was also in doubt, will I succeed? Will I pass this exam or not? And now looking back, that was such a trivial worry that I even did not have to worry. And I was the guy who was not wasting too much time. I was studying. So I think what we need to worry is how I can be the best, how I can serve the best, serve the patients, serve their families, serve my friends, serve my colleagues, and a big picture, how we can leave our mark and improve the world around us.
Yeah, definitely. We are talking about leadership, and you also mentioned scholarly activities and research. And this is something that worries a lot of medical students. How do you look at an application when you see it in terms of research? And what do you look for?
Yeah, no, you brought up a very good point, and I want to spend a minute to talk about that. So, we think that, publishing anything and everything will count. Not true.
Yeah.
I think you really need to have a clear path. If you want to become a hematologist, then you need to publish around area of expertise and also ask this question: if I work on this project and give my precious 1 month, 2 months, or 6 months to this project, how this is going to change the people, change the lives, change my environment, or have an improvement? Is it going to have some angle of innovation in that field? Or is it something which I'm trying to make sense of from the scattered data out there? Or is it something I'm going to just repeat but make it a better teaching tool? My good review paper, if you pick up and read it, will it help you serve patients better or not? So I see people, one day they publish in pulmonology, next day they publish in gastroenterology, third day they publish in ethics, fourth day they publish in something else. So there is no theme. And the quality of the work matters a lot. It may be just 1 or 2 projects, but a real passion behind it and a good quality work, which makes a small dent in the surrounding around you. That small impact can be meaningful for you and for people around you. That's what matters. People say, I have done XYZ number of publications. Maybe 10 is a good number, maybe 15 is a good number. Not true. I think what's more important is what you want to do. And most of the people are working individually, but without the help of a mentor in their field. And the mentorship could be available around you. We just have to go and seek out. Maybe one mentor is busy, then try to find another one. But most of the time, hard in acquiring some basic skills, but they're not delivering because they don't know the current practice in their field and what's known and what's unknown. So they do not know that. And that's where a mentor can step in and make an impact. Now, first year, second year, third year, even final year student may say, I don't know what I want to do. I want to become a cardiologist in the morning, and the evening I want to become a pulmonary critical care. And third day, I want to become an ER physician. Well, at least have a theme. You have to be clear. Do you want to become an internal medicine physician, a surgeon, a neurologist, or a pediatrician, or gynec, or gynecology? You have to have at least one broad theme. So if it's medicine, then you can pick and choose. No, I don't want to do rheumatology and I don't want to do nephrology, but these are the top 3 things I can. So in the beginning, it's okay to do that. But then at some point, you have to declare and focus on, and that could be even in the first or second year of your residency. So you don't have to declare. And this is where, when I'm working with somebody who has worked in cardiology for 2-3 years and already have 20-30 publications, if I show them what does oncology truly mean and truly like it, and they change in the last minute, they have a strong story to tell that this is the exact time when I realized that I really have more ambition, a passion for hematology or oncology. I changed. So all previous work they have done is not a waste. It's just the foundation, so they can keep building on that foundation. So be clear in your head. You just don't do scattered work, and always work with a mentor. Many times I see, people work with a junior mentor, which may be a 1 year senior who still in need of. You may waste your time and effort. Though I personally believe no effort, no hard work go waste. You will ultimately figure it out. So work smart.
When you're publishing just for the sake of publishing, then it just does not, that comes to your integrity as well, because what are you trying to contribute to the medical literature? Because at the end of the day, if a doctor in a clinic opens up your paper and your paper is not up to the mark, it's going to harm the patient, and you're indirectly creating a problem in the field of medicine rather than actually contributing something.
Now looks like I have a share button active, and I'm going to share the screen. This is a slide which I actually took it from a mentee's presentation. And this is a wonderful story of that person. So, and we know this, people see you are in a prestigious medical school, a residency, or a job, so they see success. But they need to see, and what we need to see as we are starting that journey, that there are a lot of things which are behind the scene. There is persistence, hard work, late night work. There will be rejections. There will be sacrifices where you're not going to a function, you're not going on vacations. You have to stay disciplined. You have to be open to the criticism to get better. And as a young person who's ambitious, there will be doubts and failures. There will be risks involved. It's okay to fail. That's the price you pay to be that successful. So now let me go to the next slide. And this is the story of this individual, Irbaz. Irbaz is now himself an associate professor and a faculty. He's a graduate from Nishtar Medical College. And he has done a fantastic work. So the reason I'm showing you this is a classic example of somebody who starts like any medical student in Pakistan. So this is his presentation. I don't have his permission to share this, but I'm sharing it. I'll later on call him and let him know I use his slide. So on the top, he's showing us the skills. In the middle, he's showing us the pictures of the mentors. And at the bottom, he's showing us the different institutions where he went. And at the most bottom line, he's showing that the degrees he acquired. So he said, somewhere in 1986, that's where he was born and started his journey. In 2009, he was at the Nishtar Medical College. And he said skills, I will say he learned a lot of skills, but he said that in a real sense, he did not really get extra skill beyond what is needed in the medical school. Then he was a really good student, a lot of gold medals and distinctions, and won a scholarship and went to University of Sydney and did a master's in clinical epidemiology. And then he started his residency in University of Arizona. That's where I was a faculty before moving to the current job. And that's where he was initially working with the chief of cardiology. But bad luck, started spending time with me. And so we converted him from cardiology to oncology. And from that, that's where his publications changed from cardiology to oncology. and he went to Mayo Clinic, which is ranked #1
Yes.
hospital system in the USA and by extension in the world.
Yes.
One of the leading institutions. That's where he went for his HEMONC fellowship. And then part-time, he also was able to complete a PhD degree. And from there, he won an extra scholarship. And he went to Dana-Farber and did some advanced oncology fellowship. Also did clinical informatics from Massachusetts General.
Yeah.
And then from Harvard, did a master's in bioinformatics. So,
Wow.
and then on the top, he's talking about his skills. When he did his master's in clinical epidemiology, that's where he acquired more mathematics and statistical skills and started doing meta-analyses. In University of Arizona, in the medical environment, that's where he started publishing with the secondary data. And then during his fellowship, he improved further. And that's where he started learning AI, machine learning, learn about clinical trials, and genomics and bioinformatics. So this is a wonderful story of somebody who really shows you a personal leadership.
Yeah.
This cannot come from somebody who just followed the direction. This comes from somebody who took ownership and kept improving. And this is his slide. So he said, he thinks that he started late. So his advice is start early on in your medical school and start acquiring some skills, but it's never too late to start. And then set big goals and know exactly why you want to do that.
Yeah.
Do you really want to do that or not? Because you have to pay the price for all the success you want to achieve. You have to pay the price and sacrifices. And then at the same time, find a good mentor and be a good mentee. And I will say, do not find just one mentor. You may have to find multiple mentors. Maybe one mentor is good in one aspect, another mentor may be good in the teaching, third mentor may be good in research, fourth mentor may be good for innovative work. So try to find a group of good mentors. And the mentors need to be, real mentors, not 1 or 2 year senior and posing as a mentor. They are doing their best, but they are not the best.
Yeah.
And then have a career development program. And this is where you really need to show your leadership that do not aim low, aim high. Keep improving.
Yes.
Attain skills. And that skills could be all the things we talked about. It could be learning just basic thing, how to make a table, how to type, how to use a PowerPoint, and then keep building on those skills. And once you have done that, then you apply those skills. And during this journey, be flexible. There may be setbacks. There may be some failures. There will be hard criticism, but keep improving. And continue to self-evaluate, continue to seek feedback and improve. And ultimately, you will achieve your goal. And what can be a goal of a physician? A goal of physician will be, I want to serve my patient with excellence. I want to teach with excellence. I want to innovate with excellence. I want to be an excellent individual wherever I live in that community, in that surrounding. I am serving my community in the best possible way.
Yeah.
So I just wanted to share this story with you guys. And then I was last night sitting and thinking about this talk and trying to organize it. So there are some talking points. I will leave it on the screen so I think people can pause and maybe enlarge and read that. Let me see if I can enlarge it so it may be easy for them to read it.
Yeah.
I recently read and finished this book by Adam Grant, who is a faculty at Wharton Business School, and it's called Hidden Potential. And so some of these points, I took it from his book, but this is what we talked about during the session today.
This was amazing. The slides that you showed and the entire flow diagram that you showed, it really gives you a very clear idea of how journeys are. And it's very important, as you said, to not forget that when you're looking at someone, and because there's a lot of hard work involved in all of these things.
Yeah, no, we should plan ahead, plan for years and decades. You went to medical school, it was at least 12 years of planning and hard work. You do not just end up in a medical school on merit. without all that years and years of hard work.
Yeah.
Similarly, medical school is a journey. The other mistake which I feel some people make is, their goal is to enter into residency.
Yeah.
I think we should look at it's a marathon.
Yeah.
And if you qualify for a marathon, that means now you are in internship, in residency, that just qualifies you. So if somebody matches into a program in the USA, they should not stop working hard. Then their goal should not be just graduate from the program and start practicing and get a nice paycheck. That's not the motivation as a physician. That's where your journey actually, it's a marathon. That's where your journey should continue to progress. You should continue to progress and improve and learn and achieve your goals. And the goals are continue to improve and learn, continue to help people around, continue to serve your patients with excellence. And so you should continue to work hard and keep improving during your residency and beyond.
Thank you so much, Dr. Anwer. This was so insightful, so inspiring. It's such a great honor.
And it was a pleasure. Thank you for the opportunity. Through this podcast, I wish, I hope, I try that, the people benefit from it.
Yes.
And benefit the people which are around them and benefit the patients they serve and benefit the families they serve. Thank you so much.
Thank you so much.